Hello, welcome to another conversation with Swallow the Pill. My name is Zena. I am your friendly nurse educator, and our topic for today is hypertension. Hypertension, blood pressure, what that means to your body, and why it is known as the silent killer. Let's talk about it. If this video helps you in any capacity, please like, comment, and subscribe and follow me because I'll be posting more. To follow this video is going to be a video about diabetes and how that affects your body whenever it's uncontrolled. So if you want to see more, please subscribe so that you can keep up with the videos. Blood pressure is essentially this. This is how I want you as a patient, as a consumer, to think about it. Blood pressure is a conversation that your heart is having with the rest of your body. Sometimes that conversation is super loud, like your heart is yelling at the rest of your body. Sometimes your heart is having a normal, simple, calm, cool, calm, and collected conversation with the rest of your body. Everybody is in agreement and everybody is on one accord. And then sometimes your heart is talking to the rest of your body in a small, quiet voice. It's super low, but everything is fine. But it is the conversation that your heart is having with the rest of your body when everybody is yelling and everybody is talking loud. Your heart is basically screaming at the rest of your body, and it is just over talking everybody. And so the conversation is really loud, so everyone is affected. That is how I want you to think about your blood pressure. The loud conversation is hypertension. The balanced, cool, calm, and collected conversation is a normal blood pressure that is conducive for a great environment in your body. And then the small, quiet, little whispery is low blood pressure. But we're not talking about low blood pressures today. We're going to talk about hypertension. All right, so in thinking about your blood pressure in the form of a conversation with the rest of your body, it is your heart is yelling, right? So you are hypertensive or you are dealing with issues of hypertension, which means your blood pressure is consistently above 120. Normal blood pressure, they've said for so many years, as many years as I can remember, normal blood pressure is a blood pressure of 120 over 80. Well, actually now, 120 over 80, is that a good normal blood pressure? The definition of a normal blood pressure is anything less than 120 over 80. So if you are right at 120 over 80, baby, you are borderline hypertensive. And you do need to keep a close eye on your blood pressure. Okay, so what is a good definition for blood pressure? How should you understand it? It is how hard your heart has to work to get blood to the rest of your body, to the rest of your organs, to the rest of your blood vessels. It is the force at which your heart is working to pump blood to everywhere else, to your body. The heart is a pump, and its job is to feed the rest of your body. And your blood pressure dictates to your heart how hard your heart has to work in order to do its job, to be able to give everybody, everywhere else in your body, what they need. It is the source of which your organs live, from your heart. Why does it matter if you are hypertensive or if you have hypertension? Like I said, your heart is talking to everywhere else. It's talking to your entire body, right? And if hypertension or a hypertensive moment goes unmanaged and untreated, it leads to strokes, kidney failure, peripheral artery disease. It leads to more complications to the rest of your organs, because then your other organs start having issues, because the hypertension then feeds down to them and they can start failing. It can lead to a stroke. How can it lead to a stroke? If the blood in your body is not flowing effectively, if there's not balance in the flow is too slow, or the flow is interrupted, then there can be a clot. Then there can be it can break down the strength of those vessels, and those vessels can burst, which then leads to a stroke. And then a stroke, now you have an interruption in your brain. Now your brain has a break in the flow of blood, so now your brain is affected. So if you leave blood pressure, your blood pressure is hypertension, if you leave it unmanaged and untreated, it interrupts the flow to your brain, which then leads to a stroke, which then can lead to you being debilitated, and it leads to you not having control over your body. Do you want that to happen? Because blood pressure is something that you can control. It is not unmanageable. It's something that you can manage yourself. Leaving your blood pressure staying in hypertension too long, then can lead to kidney failure. It can then start breaking down your kidneys. Your kidneys won't be able to filter the waste appropriately. But blood pressure is something that you can control. How can you control your blood pressure? How can you prevent these things from happening? Diet and exercise is one. Are you moving your body? You don't necessarily have to be sprinting hills every day. You don't have to necessarily be lifting massive weights every day. But you can go for a walk for at least a minimum of 30 minutes a day to get your body moving. You can try to reach 10,000 steps per day. You can set different goals with your body. I'm going to walk 2 miles today, and that's going to be my activity. Diet also plays into that as well. Salt is not your friend, especially in the setting of hypertension. Salt will raise your blood pressure. Salt causes your arteries to narrow, which then increases your blood pressure, because then if there is a narrowing of those blood vessels, blood cannot flow, which makes your blood pressure higher, which makes your heart scream at the rest of your body, I'm trying to give you what you need, but I can't get through. Think of it like that. The blood can't get through to be able to do its job. So when you add salt and you are already hypertensive, you're doing yourself a disservice. You're increasing your blood pressure. So you need to take salt out of your diet. And I'm not saying have a tasteless diet, because I like to eat too. I like for my food to taste good too. But you can transition to things that are low sodium. You can transition to things that, such as Mrs. Dash, that don't have salt in it, that still taste good. Instead of eating bacon every day, try egg whites and oatmeal. That's a protein and a carb, because that's what a balanced diet should be. But that's a conversation for another day. Instead of eating stuff out of the can all the time, because canned foods are very high in sodium. Start looking at the back of the packets of the things that you eat and see how much sodium is in there. So you do your due diligence. So 1, diet and exercise. 2, medications. Talk to your doctor. Stop being afraid of going to the doctor. Talk to your doctor. Get your doctor. Let your doctor know what's happening with your blood pressure. Check your blood pressure. That's another one. Regular monitoring of your own blood pressure. Check your blood pressure. Keep a diary of it. I checked my blood pressure 5 days this week, and every day it was this. Is this something that I should be concerned about? Is there a medication that I can start to help me to manage my blood pressure better? Those are some things you can do to help you manage your blood pressure. Another thing you can do to help manage your blood pressure, lifestyle changes. If you know you got a lot of stress in your life, eliminate that stress. It can be a person, it can be a group of people, It can be your job, and I'm not saying quit your job, but do what you need to do to get yourself to a point of where you're not stressed out all the time. I personally, and I'll tell you my story, I was an assistant manager of a CVICU, top CVICU in this country, and it was stressful as hell. We saw all the things you can see when it comes to CVICU. It is a pretty large unit. We had over 150 to 160 nurses that I was managing, and I was stressed out all the time. And I saw it within my body. I saw it within my blood pressure. I saw it within my health. Y'all know what I did? I got a new job that's not as stressful. And this is the best that I've ever felt. I also had some stress within my family. What did I do? I eliminated those stressors and I started going to therapy. So I say that to say this: lifestyle changes. If you know you're stressed out, do something about the stress. I'm not saying quit your job, because if you know you need your job, stay at your job. Don't quit because I ain't got no money for you. But stay at your job. But do something about what you know is causing you to be unhealthy. Don't just sit there and ignore it, because then that can lead to worse outcomes, and you don't want that. That's not good, especially if you're trying to live and have an abundant life. All right, so to recap this video. So, blood pressure, hypertension. Hypertension is the silent killer, especially if it's left unmanaged and untreated. Your blood pressure is something that is modifiable. It is something that you completely can control. You can control it with diet and exercise. You can control it with lifestyle changes. You can also control it with medications. And you can control it with regular monitoring of your blood pressure. Check your blood pressure. Do you know what your blood pressure is today? Have you checked it for today? I checked mine. Check your blood pressure. Buy you a blood pressure cuff to keep at home. You can get them from CVS. You can get them from Amazon. You can get them from Walmart. You don't necessarily have to go to the doctor's office to check your blood pressure. Buy your own blood pressure cuff and check your own blood pressure. Keep a diary of it. You can tell your doctor, I have checked my blood pressure 5 days this week, and this is what it is. Can we do something about this? Can you please help me get to a better life? I want to be healthy, and right now I see that my blood pressure is consistently over 120/80. So I want to get to where my blood pressure is less than 120/80. So talk to your doctor. Have conversations about your doctor. Don't continue to allow your heart to scream and yell at the rest of your body, because you don't want your body to be toxic with each other, your organs to be toxic with each other. And that is exactly what you do when you allow your body to stay hypertensive and don't do anything about it. So that is Zena. I'm Zena, and I'm sharing what I know with you. So thank you for watching, and I hope this helps you. Check your blood pressure. Don't stay hypertensive.